Today I am going to discuss about the odontogenic tumors. Odontogenic tumors means children of birth of tooth will have certain problems. These will lead to certain amount of tumors. You require epithelial tissue for formation any odontogenic tumor. The epithelial sources are reduced enamel epithelium, cell rests of molasses, cell rests of serrae, then ectopic epithelium and enamel organ epithelial cells. I will repeat it. Odontogenic birth of a tooth. When there is birth of a tooth, you see a lot of changes that may lead to formation of tumor. These are called as odontogenic tumors. So odontogenic, for epithelial tumor to occur, you require some epithelial cells. Some epithelial cells examples are reduced enamel epithelium, cell rests of serrae, cell rests of molasses, reduced enamel epithelium, then ectopic epithelial cells. Ectopic means from some source these epithelial sources will come, thereby leading to formation of tumors. I will discuss one of the classification. I will discuss it in the next class. We will go for one of the easiest possible understanding ameloblastoma. Ameloblastoma. This is the most commonest tumor. If you are practicing in your life, you are born to see one ameloblastoma. It was called as adamantinoma. It was called as adamantinoma in the past. Now it is called as ameloblastoma. As the name itself indicates, ameloblastoma, enamel formation. When enamel is formed, there is formation of an ameloblastoma. Understand? Before the formation, so it is defined. Ameloblastoma is defined as a odontogenic tumor arising from enamel organ-like tissue before any calcification occurs. It is unicentric, non-functional, intermittent in growth, clinically persistent, anatomically benign. Anatomically benign. So, I will again redefine it. I will again tell what the definition is. Ameloblastoma is defined as a odontogenic tumor arising from enamel organ-like tissue before any calcification occurs. It is unicentric, non-functional, intermittent in growth, clinically persistent, anatomically benign. Anatomically benign. What do you understand by the word anatomically benign? Anatomically benign means most of the benign tumors there is no recurrence. When you call somebody as benign tumor, it doesn't recur. But ameloblastoma recurrence rate is too high. Recurrence rate is too high. Anatomically benign. Anatomically, when you see it looks benign in the microscope, but recurrence is more. It goes on recurring. So the definition states recurrence is more. It's also called as multilocular. It's also called as multilocular cyst-like lesion. Cyst and ameloblastoma, they go hand in hand. The features are same. Everything is same. So some cyst will lead to formation of ameloblastoma. The commonest cyst where there is transformation to a ameloblastoma. Example is dentigerous cyst. Covered, I think, no? Dentigerous cyst covered, no? Covered. Dentigerous cyst. So the characteristic feature, it is a odontogenic cyst, developmental odontogenic cyst. Understand? Developmental odontogenic cyst. The features are not unique. The features are not. It is simple in nature. Odontogenic cyst, dentigerous cyst. It's not unique in nature. You have got a ribbon-like epithelium. You have got ribbon-like epithelium. When you call it as ribbon-like epithelium, the rate ridges are lost. The rate ridges are not there. So, but in this ribbon-like epithelium, if you see Vickers and Garland's criteria, so hyperchromatism, chroma means color, hyperchromatism, beauty lies in the eyes of the beholder. Understand? For one person it looks beautiful, other it may not look. So hyperchromatism is more color. Hyperchromatism, vacuolization, space is created, loss of polarity means the cells are put apart. So if these features are seen in a dentigerous cyst, it may get transformed to ameloblastoma. Understand? I will tell it once more. Dentigerous cyst, ribbon-like epithelium. If the features, histological features of it doesn't have any unique feature. Dentigerous cyst doesn't have any unique features. But in the histopathology, if you see, what do you see? Hyperchromatism, vacuolization, loss of polarity. This type of features are called as Vickers and Garland's criteria. If these criteria are present in dentigerous cyst, that may transform to ameloblastoma. blastoma. They correspond to ameloblastoma. So ameloblastoma are different variants. So histopathological classification is there. The basic clinical classification of ameloblastoma is intraosseous, extraosseous. Intraosseous, intra within the bone. Extra means outside the bone. Intraosseous, extraosseous. So it is more common in mandible. It's more common in mandible. So there are different variants of ameloblastoma. So coming to clinical features of ameloblastoma. Clinical features are very unique in nature. It is asymptomatic. It is painless in nature. It may cause a displacement of the tooth. It may cause dislodgement of the tooth. It may cause malocclusion. It may cause pathological fracture. It may cause drooping of the lip. It may cause facial palsy. Then it may cause asymmetry of face. Asymmetry of face. These are the clinical features what you commonly see in ameloblastoma. The whole bone has become weak in nature in ameloblastoma because it is multilocular in nature. There are perforations in the mandible. There are perforations in the mandible where there is lot of radiolucencies are seen. So the radiolucencies you see are honeycomb appearance or soap bubble appearance. If you wash your clothes, you will be seeing when you put some soap powder, you see lot of big bubbles. But in the honeycomb, you are seeing small orifice opening. Small orifice opening are seen in honeycomb appearance. Understand that orifice when they are small, they are called as honeycomb. Soap bubbles are larger in nature, so they are called as soap bubble appearance. More and more bigger perforations are there. So what happens? The outer bone is compact bone. Whichever bone you are possessing of. How many bones are there in your body? How many bones don't know? 206. Whatever bone it is, outside is compact, inner is cancellous. Cancellous bone, immature bone, spongy bone, whatever you call. Understand? So this spongy bone, immature bone, this will get matured. It will mature and become compact bone. So this ameloblastoma, what will happen? It will move through least resistance. It moves through least resistance. It moves through cancellous bone or spongy bone. If there is a water spilled out here, you put a sponge in it. What will happen? It will absorb. So what happens? Movement of water inside the orifice opening of sponge is here. Like that, in the cancellous bone or spongy bone, the movement is very easy. Then what happens? It will burst open the compact bone because the fluids that are present, and then you will see enlargement of face in ameloblastoma. Enlargement of face, you can see it in these are the clinical features. It's more common in African race. They go to massive size. If you take your Schaefer textbook, you'll see big size ameloblastoma present. Understand? They go to massive big sizes will happen. So once this ameloblastoma occurs, recurrence rate is more. Why? When you are doing some surgeries, some epithelial cells are left over. These cells, what? They start regrowing. Regrowing is what? It's called as proliferation. They grow and grow. Thereby recurrence rate is very high in case of ameloblastoma. When you are doing specific surgery, the treatment of this ameloblastoma is surgical excision. So when you are excising it, you are removing the vital bone. Means good bone also is removed. So that the spilled over epithelial cells also are removed out. The spilled over epithelial cells are removed out. So that's the basic thing about it. Ameloblastoma clinical features is this common in African race, common in mandible. Comparing to maxilla, you see more in mandible. So mandible is strong or maxilla is strong? Mandible is stronger. Maxilla is stronger. When it comes to strength of the bone, mandible is stronger. But though it is attached to the base of the cranium, mandibular bone is stronger. We feel that maxilla is stronger. Maxilla is cancellous comparing to your mandible because of your sinus. It is cobra, it is not very strong. So when you are doing an upper extraction, you should be very cautious. comparing to mandible. Now when you break the mandible, you break the maxilla. Understand? The whole maxilla will get collapsed, distorted, destroyed. Understand? So these are some of the features. So ameloblastoma are of different variants. They are of different variants. The most common is plexiform ameloblastoma. Follicular ameloblastoma, plexiform ameloblastoma. I am talking of histopathological variants of ameloblastoma. Follicular ameloblastoma, plexiform ameloblastoma, desmoplastic ameloblastoma, acanthomatous ameloblastoma, unicystic ameloblastoma. These are some of the variants what you see, different variants of ameloblastomas. You see a lot of variants in ameloblastoma. They are ameloblastomas only. Seeing the vagaries changes in the histopathology, we call them as follicular ameloblastoma, plexiform ameloblastoma, desmoplastic ameloblastoma, acanthomatous ameloblastoma, unicystic ameloblastoma. Like that, they give different names for the ameloblastoma.
11 minutes. 11.
Different vagaries. So, follicular ameloblastoma. What is this typical follicular ameloblastoma? It is like your heart shape. Like your heart shape. So, it looks like heart. You know how to, you see heart shape. In that, when you see it under microscope, what you see? You see stellate reticulum-like cells. You see stellate reticulum-like cells. Where did you read your stellate reticulum-like cells? In your first chapter, you talked about stellate reticulum-like cells in enamel organ. If you go back to the tooth development, stages of tooth development, you see enamel organ, dental papilla, dental sac. Remember what? Enamel organ, dental papilla, dental sac. So in the enamel organ, it is also heart shaped. The derivative of enamel organ is enamel. Derivative of enamel organ is enamel. In that, what happens? In inner enamel epithelium, outer enamel epithelium, stellate reticulum, stratum intermedium in late stage. 4 layers: inner enamel epithelium, outer enamel epithelium, stellate reticulum-like cells, then stratum intermedium. So 4 layers are seen. This stellate reticulum-like cells, the cells are pulled apart. The cells are pulled apart. They are separated apart because of. First you are sitting, no? They are pulled apart because of glycosaminoglycans. So it is hydrophilic in nature. Glycosaminoglycan is means it has got 2 affinity towards water. It absorbs water. More and water, the cells will get separated, departed apart. So the desmosomal attachments are pulled apart. They look like star shape. They look like stars. The same feature is seen in follicular ameloblastoma. Follicular ameloblastoma is heart shaped. The cells there look like stellate reticulum-like cells. The cells are pulled apart. Understand? It looks like stellate reticulum-like cells. If you see this feature, we call it as follicular ameloblastoma. In plexiform ameloblastoma, the variant is, you see different variants in it. They are in lines, strands. You are sitting in a strand like benches arranged strand. They are in lines in nature. The stellate reticulum is thrown in between the lines. Here, if you take this as a strand, here you see stellate reticulum-like cells running. So that is called as plexiform ameloblastoma. Understand? In follicular ameloblastoma, you see heart-shaped internal dental epithelium, external dental epithelium, stellate reticulum, stratum intermedium. They are pulled apart because of hydrophilic nature of glycosaminoglycans. Here also hydrophilic is seen, but they are in strands. In plexiform ameloblastoma, they are in strands. In between them, what is happening? The cells are pulled apart. So you see stellate reticulum-like cells. When you see stellate reticulum-like cells, these are called as what? These are called as plexiform ameloblastoma. Then coming to unicystic in nature. The name of ameloblastoma indicates what? It is multilocular in nature. But we are talking unicystic. It's a unique thing. It's a unicystic. This hero is unique. this heroine using some uniqueness is there. So this ameloblastoma is unique. You see, only unicystic means only one radiolucence is seen. Only one big radiolucence is seen. It is classified into luminal, neural, and intramural. Neural at the periphery, neural, intraluminal, luminal growth above. So you see luminal, intraluminal, neural at the base of it. So you see the development of